Hello, hello. This is Shamika, your chronic care management nurse practitioner. I wanted to come online and do an informational video. I haven't did one of these in a long time, but this one is about the diabetic medication semaglutide slash Ozempic slash Wegovy. I was talking to a childhood friend this morning, and we were talking about how many people here in California either have trepidations about taking a medication that's made for diabetics to lose weight, or their doctors won't prescribe it for them. They want it, but their doctors won't prescribe it for them. So I wanted to give you the information that I researched for myself. So I could know what I was going to be taking, because I had decided that this is something that I wanted to do, being that I have a long history with obesity. So let's go. What is semaglutide? Semaglutide is a GLP-1 receptor. It's a hormone which mimics a natural occurring hormone that's produced inside our bodies. But when we have excess fat cells, all the natural processes are thrown out the window, and our body don't produce the GLP-1 hormone like it should. So we overeat and we gain weight, right? But semaglutide, or the GLP-1 hormone, helps to regulate the appetite by increasing the feelings of fullness after meals. And this occurs by delaying the stomach from emptying the foods into the intestines. So the results are you feel fuller longer, and then this action sends signals to your brain saying, hold on, stop, we're still full, don't feed us no more. So your appetite is decreased tremendously and you lose a lot of weight. It also lowers your blood sugar levels. It was originally made for diabetics, but during the trial period, they noticed that along with lowering the hemoglobin A1C, it also lowered individuals' body weight by 15 to 20% over a 64-week period. That's about 16 months. And that was at the maximum dosage. They did a lot of trials. The trials were conducted at 536 sites in 33 countries. And the countries were Canada, Mexico, Russia, the Ukraine, Turkey, India, South Africa, Japan, Hong Kong, and then multiple European countries like Argentina. And then they did some in the United States too. And after all this research, they made semaglutide available in 2001. They increased the dosage of the medication semaglutide. The Ozempic is for diabetics, but they increased the dosage and they put a name on it called Wegovy. And the FDA approved the Wegovy for weight loss, but with a hefty price. The price tag at most retailers like CVS and Walmart is $1,300 for a 1-month supply, which that's extreme. Originally, you couldn't get it from your insurance wouldn't cover it, and they're still trying to fight for your insurance to cover the Wegovy, but your insurance will pay for the Ozempic, which is the same thing as semaglutide, but in a lower dosage. So it's Ozempic. What are some of the side effects of this medication? The most side effects is GI, like stomach upset. Nausea, indigestion are the two most common complaints that I hear from everybody, from a lot of people, not everybody, from a lot of people. And then sour stomach, belching, excess gas, or air in your stomach, and then feeling full, feeling pressure in your stomach because the food is just sitting there. It's not dumping into your intestines. Heartburn and passing gas is another side effect. It's unknown whether semaglutide causes thyroid tumors in humans. However, when they tested it, when they did research on lab rats, it did cause thyroid tumors. So that's why they say if you have any thyroid problems, then you're exempt from taking this medication. They still to this day, I looked on the FDA website, and they still to this day have not found a human being that have developed thyroid tumors. But because those rodents develop thyroid tumors, then they said no. And then if you have a family history of medullary thyroid cancer, they're saying no, you shouldn't take it, right? Semaglutide is contraindicated in patients with a personal family history of multiple endocrine neoplasia syndrome type 2. Listen, if you have that, if somebody in your family have that, then you'll know about it. If not, then don't worry about it. It's just a big word. But if someone in your family has it, then they're saying that you're exempt too. You shouldn't take this. So again, how much weight will you lose? Well, the injection paired with a calorie deficit, you're going to automatically have a calorie deficit. By the second month, you're going to notice your appetite is almost demolished. You should expect to lose between 15 to 20% of your body weight. So that means if you're like 200 pounds, 20% of that would be 40 pounds while on the medication. And that's average for people. It could be more, it could be less, but the average is 15 to 20% of your body weight. It also helps with lowering your blood sugar. So if you're a diabetic and you don't have thyroid problems, you should definitely be taking a GLP-1 like semaglutide. It'll help you in multiple ways. So is this medication right for you? If you have thyroid issues, thyroid cancer in your family, the answer is automatically no. You need to be put on a different type of weight loss program, but this one is just not the one for you. If you have any thyroid issues, I wouldn't prescribe it to a person that have thyroid issues. I just wouldn't take the chance. But listen, side note, many times people with thyroid issues, hypothyroidism, that includes weight gain, all they need is their thyroid medication adjusted. And that just takes the right care provider testing your thyroid levels, your TSH levels, and then managing the medication, scheduling the medication so you could get therapeutic effects, which will increase your metabolism and lower your body weight. So back to, is the medication right for you? Have you been trying to lose weight and you've been unsuccessful? That's the first question. The second one is, are you willing to commit 6 months to individualized program with support? And have you had bariatric surgery and regained the weight back? And then, is your body mass index, BMI, greater than 30? Or greater than 27, and you have 2 chronic diseases, like you have diabetes and high blood pressure. You're not in the obesity category. However, you're over 27 and you have 2 chronic diseases. The diabetes, high blood pressure are the most common. And if the answer is yes, then this medication might just be right for you. It might just be something that'll help you. But it's so expensive, number one. And number two, it's so hard to get prescribed because it was originally made for diabetics. My suggestion, if you do decide to take the medication, is get in a weight loss program and make sure that you are committed, because this is just a tool too. The doctors say that it's a long-term medication. You have to take it for the rest of your life, because once you stop, you regain the weight. And while that is true, you do regain the weight. If you change your weight set point, then you won't have a problem. So what is a weight set point? A weight set point is the natural tendency of your body to defend weight changes that feels uncomfortable, right? So the set point is the weight your body naturally maintains and returns to after a period of restricted low-calorie dieting, or if you eat too much. So if you eat too much and you try to lose the weight, your body is going to go back to that set. You have a set where your body just stays most of the time. Or if you go on a diet and lose like 20 pounds and then start back eating the way you were eating before, your body is going to go right back up to that set weight. That's your weight set point. And what you need to do on this medication, like I said, it's just a tool. If you are using it for weight loss and you're not a diabetic, it's only a tool. What you need to do is get to that sweet spot, whatever that weight is, and you got to maintain it for 6 months to a year. If you maintain it for 6 months to a year, then you've changed your weight set point. So even if you go off the medication, your body is going to go, it'll gain a couple of pounds, but it'll go back to that weight, whatever that is, whether it's 150 pounds, 165 pounds, whatever you're trying to get to. That's how you change your weight set point. You lose a weight, get to that sweet spot, and stay there for 6 months to a year, and it has changed. These are all tools. These are all tools to just help you with the weight loss. However, you're ultimately responsible. You're the only one that can make the difference in this. So you have to be all in. Like I said, you have to commit to it for 6 months to a year, and you got to put yourself first, and you can make it happen. It won't have to be a lifelong medication. Obesity is a lifelong chronic disease. It doesn't go away. We yo-yo diet, we gain weight, lose weight, gain weight, lose weight. But the key to it is changing your lifestyle. It's a must if you don't want to deal with it. And I believe that if you take care of obesity, then all those other chronic illnesses, you knock them out. The diabetes go away, the high blood pressure go away, the high cholesterol go away, the aches and pain, back pain, leg pain, hip pain, all of that stuff goes away, because obesity is the mother of most all chronic diseases. So again, this is Shamika. I just wanted to come in and give you a quick informational about this, what they're calling a miracle medication for most. If you need any assistance, if you have any further questions, please don't hesitate to ask. I'm always available. Not always, but I'm available for questions if you have any. Have a great evening. Peace.